Okay, so living with a stoma is definitely a journey, right? And like any new journey, you learn as you go. Today, we are going to dive into one of the most common bumps in the road, keeping the skin around your stoma, your peristomal skin, healthy and irritation-free. Let's get right into it.
So, first things first, if you've ever looked down and seen some redness or irritation around your stoma, I want you to know something really important. You are absolutely not alone. Seriously. Some studies show that up to 70% of people with a new stoma deal with this. It is incredibly common. And the best part is, it's totally manageable.
And here's the thing, and it's a really big deal. This kind of irritation often flies under the radar. You might just think, oh, a little redness is normal. It's part of the deal. But really, it's often the first little signal your skin is sending that a small adjustment is needed. Learning to spot these signs early? That's the secret to staying ahead of any real problems.
Okay, so let's put an official name to what we're talking about. It's called peristomal dermatitis. I know, it sounds a little intimidating, but don't worry, it's really just the medical term for skin irritation happening right around your stoma.
So what is it really? Well, in short, peristomal dermatitis is what happens when your stoma output, the very thing your pouch is designed to keep contained, sneaks out and touches your skin. Your skin just isn't built to handle that, so it reacts, It gets red, it gets sore, it gets irritated. Now, you might be wondering, what's causing this? Well, the number one culprit almost every single time is leakage. And leakage can kick off something I like to call the vicious cycle, where one tiny problem can snowball into a much bigger, more frustrating one. But here's the good news. You can absolutely break the cycle. Let's just walk through this for a second. It all starts with a poor fit, right? Maybe a tiny gap of skin is left exposed. Then output leaks onto that skin, which causes irritation. Then the irritated skin starts to get moist or weepy. And what happens then? Well, the next pouch you try to put on just won't stick properly to that moist skin. And a pouch that doesn't stick well, you guessed it, it leads to even more leaks. You see how that works? It just goes round and round. The trick is to break that chain, and that's what we're going to talk about right now.
The very first step to fixing a problem is knowing what you're actually looking at. Every single time you change your appliance, you're getting a chance to become the world's leading expert on your own skin. So let's focus on the two most common types of irritation you're likely to see.
Okay, on one hand, you have irritant dermatitis. This is a direct result of output touching the skin. It's going to look red, kind of raw, and it might be a little moist or weepy. Pretty straightforward. Then, on the other hand, you could have a fungal infection. The area under your appliance is warm and moist, kind of the perfect place for fungus to set up shop. The key difference to look for here are those little satellite spots, tiny red dots or bumps that spread out from the main rash. Oh, and it's also usually super itchy. All right, enough about the problems, right? Let's get to the good stuff, the solutions. I want you to think of these next few things as your personal toolkit for keeping your skin happy. These are simple, but they are game changers. Tool number one. And honestly, this is the most important one of all, the perfect fit. Your best defense is prevention. The opening in your skin barrier should fit snugly around your stoma, kind of like a perfect turtleneck, no skin peeking out at the bottom. And remember, your stoma can change size, especially in those first few weeks after surgery. So measuring it pretty regularly is absolutely key to keeping that perfect fit.
Our bodies aren't perfectly flat surfaces. We've got creases, dips, maybe a scar nearby. That's where a barrier ring becomes your new best friend. I want you to think of it like caulk for your skin. You can stretch it and mold it to fill in any of those little gaps, creating a nice, smooth, level surface for your appliance. It's an awesome way to stop leaks before they even think about starting.
Okay, so what if you already have some irritation? What if your skin is a little moist when you take your pouch off? That's exactly when you reach for Stoma powder. Now, this isn't for everyday prevention. This is a treatment. A light dusting on that moist area will soak up the moisture and help your next appliance get a really good, secure sear. This right here is how you break that vicious cycle we were talking about. And what if you see that itchy rash with those little satellite spots? Well, that calls for a different tool. You'll need a topical antifungal powder, something like nystatin. It's made specifically to treat the fungus. You'll just puff a little onto the rash, gently brush away any extra powder, and then you want to use a skin sealant wipe right on top before you put on your new appliance. So, you've got your toolkit. Now, let's put it all together into a simple, step-by-step routine you can follow the next time you change your appliance and notice a little bit of irritation. Here's the game plan. Once you've gently cleaned and dried your skin, apply the correct powder for the job. And here's a super important tip. Brush off the extra powder. You only need a fine dusting. Then swipe a skin barrier wipe over that powdered area to kind of seal it in. Add a barrier ring if you need it to even things out, and then finish up by putting on your new perfectly sized appliance. That's it. A simple routine that makes a world of difference.
Look, following these steps is going to solve most of the common skin issues you might run into. But, and this is so important, it's also crucial to know when it's time to ask for help. Please, please remember you are never, ever in this alone.
So if you've tried these things and your skin just isn't getting better after a couple of appliance changes, it's time to call for backup. If you see any of the things on this list, bleeding, real pain, or if you're just constantly fighting with leaks, make the call. Your Wound Ostomy and Continence Nurse, or WOCN, is an expert resource who is there for you. Reaching out to them is one of the smartest, most proactive things you can do for your health.
So as we wrap up, I want to leave you with a question to think about. We've covered a lot: the perfect fit, barrier rings, the right powders. What is one small thing, one simple step you can try out during your very next appliance change? Because taking that one active step, that is the most powerful thing you can do on your journey to healthy skin.